If you look at the private sector, it is hard to imagine that any self-respecting board member of the world's largest multinational companies, whether it's Boeing, whether it's Microsoft, whether it's Walmart, or whether it's Levi's Jeans, would enter into this sort of 30-year contract on the same basis. They don't. If they propose this type of contract with higher costs for a fixed period of time, over 30 years, they would be laughed out of the boardroom. It doesn't happen. Now, the costs of P3s were originally, by our government and by many organisations across Canada, argued to be lower. And for the reasons I've just explained to you, lower costs are no longer a valid argument for P3s. After about 10 years of debate, our government, Partnerships BC, and many organisations in Canada have finally accepted that P3s do in fact cost more. Now, the argument must change as a result. P3s are now described as value for money.
Since we launched the Public-Private Partnership Initiative in 2002, we've actually either started or completed $4.7 billion in new P3 projects. And here's what's happened. We're getting at least $131 million in additional benefits on the Sea to Sky Highway. At least $92 million in additional benefits in the new Canada Line. $39 million in additional benefits in the Abbotsford Hospital and Cancer Care Centre.
Value for money, in my opinion, is a euphemism for higher costs. Every time you see the word P3 mentioned in a government document, you'll probably see some phrase next to it that has something to do with value for money. Well, what is value for money? It's a cost-benefit analysis for 20, 30 years that predicts either lower costs or bigger benefits for P3s. Now, if you want to conduct your own value for money analysis, you can do. How? How much is a good night's sleep worth to you? Is it $5? If a good night's sleep is worth $5 to you, here's what you can do. You can multiply that $5 by 7. And you could say to yourself, well, after 1 week, I have a value for money savings of $35 because I've got a good night's sleep for 7 days. If you look at how much is a good night's sleep worth to you, what's $100? After a week, you can give yourself value for money savings of $700. Now, it's important to recognise that these hypothetical value for money savings aren't cash savings. They're a hypothetical model that in the real world bears no relation to the true costs. Partnerships BC, the Ministry of Finance, the Ministry of Health, implement all their P3 projects on a value for money basis. Gordon Campbell has repeatedly stated that the Abbotsford P3 hospital has saved us $39 million. Well, that's factually incorrect. The Auditor General staff has confirmed that those savings are not cash savings to taxpayers and that they bear no relation to cash savings to taxpayers in the real world. So value for money is at best subjective. There are legitimate uses for a value for money analysis that go over 20, 30 years, but all of them depend upon the assumptions you use to start with. And those assumptions are highly speculative. With the Abbotsford Hospital, we saw initially in 2001 that the hospital was slated to be $210 million. During the cost of contract, during the period and duration of contract negotiation for the P3 contract for that hospital, those costs went up from $210 million to $255 million to $286 million to $320 million to $355 million. And the government has claimed that that project is on budget. The problem with that is, well, what budget are you speaking about? When you claim a project is on budget, you really should check of what particular budget are you referring to, because there's been several. The same will be true of the P3 for the expansion of the highway, the twinning of the Port Mann. The same, undoubtedly, will be true of Surrey Memorial. A group called the Association of Chartered Certified Accountants in the UK, they stated that it added anywhere between 1 to 2.5 years to the duration of contract negotiation by going with a P3. So on time has limited value when that time frame is very, very long and is in many cases longer than traditional public procurement.
As we open our northern and interior ports, we're going to be using P3s to build the new South Fraser Perimeter Truck Bypass Highway. We're going to build the Pitt River Bridge. We're going to twin the Port Mann Bridge to get your resources to your markets.
The other problem we see with P3s is that during the stream of payments made annually, these lease payments essentially for 30 plus years, is that the full costs of the contract are often buried. It's very hard to find out what they are. The only publicly available analysis of P3 healthcare contracts that's gone on anywhere in the world was conducted by a group commissioned by the Association of Chartered Certified Accountants. Now, for those of you who aren't familiar with that group, they are a body of 300,000 accountants worldwide. They commissioned a research team from Manchester University School of Accounting and Finance to look at these P3 contracts, which in this case were in the UK, and to look at how much they were charging year by year by year, and try to find out if they really were giving taxpayers and patients good value. The results of that forensic analysis were very worrying, and here's why. Even after repeated budget increases, and even after repeated delays to P3 hospital projects, the researchers found that there was a premium to be paid for building your hospital as a P3. That premium was about 30%. What does that mean? Well, it's like an insurance premium. You pay an insurance premium to insure your house. You pay an insurance premium to insure your car. In this case, for every 1 million spent on the hospital construction, the P3 consortia were charging approximately $1.3 million to taxpayers. Now, what's the problem with that if the projects are on time and on budget? Well, the problem is on average, the average hospital overruns are only running at about 1/3 to 1/5 of that figure. What that means is that the P3 solution in those instances was anywhere between 5 to 3 times more expensive than the problem it was trying to solve. These are very complex, these are very abstract problems you see associated with P3s. But what the extra costs associated with P3s will do is divert money away from bedside patient care. Democracy is not a spectator sport. You're proving that tonight. You've got to get out there and do something that are problems associated with P3s.
If you can change your vote when you change your mind, that is what democracy is all about. Now polling.ca